anyway, I wanted to share some good news, and the governor started off his press conference with some data on COVID, and there is a little bit of good news. So I'm going to share my screen and show you some data because data is fun, and I love math. Hold on a second. Share. And I hope you can see my screen. I'm going to make this bigger. So what this is, oops, I think I moved forward. What this is I belong to a task force that Congresswoman Kirkpatrick put together, and we get lots of data. And this is some of the data shared by one of the public health professionals at the U of A. And basically, this is the Icu and Ward Census from April to July. At the bottom, the dates aren't on there, but the earliest date is April 20th. The last date is July. And you can see we've rolled over. You know, in the last several days here, we've made that peak, and now we're rolling over. And the governor actually showed data that is a little bit more current, and the downtrend is continuing. The blue is the ward bed usage, and the orange is the ICU bed usage. Remember, patients that get admitted to the ICU will need an ICU bed longer than somebody who's getting admitted to the ward will need a ward bed. So the ward bed valve will probably get better quicker than the ICU bed. But this is good news. We have our ICUs, you might have read in the media, oh, we're at 95% capacity. That is not true. We are at 105% capacity. We opened up beds to become ICU beds, right? We converted wards to ICUs to increase our numbers. So that's called surge capacity. So we aren't going to exhaust our surge capacity if this downward trend continues. And I think what this means is that the small things that Governor Ducey did a few weeks ago and continued today, he extended the closure of gyms and bars and pools and things today, which was very good. The mayors of Phoenix and Flagstaff and Tucson that have required masks, very good. All those things have caused this rollover that we're seeing now. If we could do a statewide mask mandate, this would accelerate, no question. This next piece is really interesting. This is PCR testing. The blue bars are the weekly numbers of PCR tests in the thousands. As you can see, as the dates move forward here, July 19th or so, I think is the last part. It might be July 12th, I can't remember. The tests have gone up to larger numbers, over 100,000. And what's really important is, again, you see the effect that the stay-at-home order had. And then we reopened, and now we're beginning to see a rollover again here of the proportion testing positive. That is a number that is the most important, is the proportion of tests that are positive. The raw number will go up of numbers of people testing positive, but if the proportion goes down, even if we're increasing the number of testing with the proportion going down, that means that infections are not spreading. So that is the important number. We were as high as 1 in 5, which is huge. We're now, down still around 1 in 5, but we're at least rolling over, and hopefully that number of proportion positive tests for PCR is coming down. I sent an email out on my constant contact today to sort of go over what viral epidemiology is and what these tests mean. Hopefully you'll have a chance to look at that. But basically the PCR test is the test that actually picks up whether you have the viral DNA or RNA in your respiratory tract. The next slide here is the serology. Serology is, do you have the antibodies in your blood? And what we're seeing here is the numbers of serology tests have not been great. I think U of A is trying to increase that. But again, the numbers of positives are going up. Basically, that's reflecting the number of people who have had the COVID virus. And they are convalescing and showing that they have antibodies. The question is, how long will these antibodies stay around? How long will you have protection? Can you get infected again? Certainly, if the virus mutates, you could get infected again. That's usually why we have a flu vaccine every year. I'm a little bit puzzled because our immune system works in a way it develops memory. So we don't always have IgG antibodies circulating around, but we have B cells and T cells that will immediately recall, I've seen this before, and ramp it up again. So there is that question in my mind, why are we so nervous about detecting IgG for months at a time? We have a memory in our immune system that should be able to pump them out again. But again, if the virus mutates, then all bets are off. Lastly, this looks a little complicated, but basically this is the moving average of the doubling time. So when the doubling time is low, things are bad. When the doubling time is long, things are better. And this is really a fun graph because it sort of puts on there what what was done, and you can see the response and the doubling time. The stay-at-home order, they're really nice increasing slope of the line for the doubling time. And then when you saw the general reopening here at 5/16, there was a couple of weeks, and then suddenly we saw this doubling time dropping. It's because people had gone out, got exposed, getting sick. And now that we've got the face masks and we've got the closing of the bars and the theaters, we start to see this line is, the slope is increasing again. And so this is encouraging news. If the governor can stay strong and continue to lead, instead of passing the buck, as Lily puts it so correctly, this slope hopefully will become more positive. But we'll have to see. Anyway, that's the data I wanted to share. Just a little bit of good news. And now I can't seem to unshare. Where was it? Oh, here it is. Stop. Okay, I think I unshared it.
Thanks, Dr. Friese. So you have a question in there from Maggie about the accuracy of the serology tests. And I know that the accuracy of some of these tests has been a big deal. So you want to address that?
Yeah, sure. Okay, so the serology tests, they can look for IgA IgM and IgG. IgG is the convalescent antibody. That means that you've recovered from the disease and now you have some persistent immunity, meaning that you have an antibody that will destroy the virus if you get exposed again. That tends to fade. Those IgG antibodies over time, I think I heard on NPR today, 2 months, they're starting to see it fade off. But what that brings to my mind is, well, we have T cells and B cells that can ramp it up again if re-exposure happens. So you might see a result where you have IgG antibodies are indeterminate. What that means is you might have had a larger volume of them present a week or two or a month ago. Now they're on the downside. Probably means that you had an immune response. You were exposed to the virus. You may have had symptoms, you may not, but having an indeterminate means that you did have some exposure. The IgM are the acute antibodies. That means you're actively infected and your body is working to destroy the virus. The University of Arizona serology test will test for both. I don't think it discriminates. It'll say positive. It means you could have one, you could have IgM, IgG, or both. Whereas the Banner serology test specifically tests for IgG. As far as the false positives and false negatives, I don't know about the false negative rate for the antibody tests. I know that the indeterminate is something that means that you probably had antibodies that are going away. Now, the Pcr tests have a fairly high false negative rate. You could test negative 30% of the time and still have the virus. So that's fairly high, especially if you're trying to take care of someone and get some level of comfort. Oh, they're negative. And then you start to, unfortunately, start thinking, oh, I cannot wear my N95. But really, a negative test doesn't really mean anything. A positive test is very powerful. A negative test can be wrong. I hope that helps. And again, I sent an email out of my constant contact today. If you're on my constant contact, take a look at that. It goes through a lot of these questions and into, sometimes I get into too much detail because it's fun, but that's me.
Yes, I was wondering if there is, do they call it a prophylaxis drug on the horizon that might be able to reduce the severity of the infection or the duration of the infection? They found that HIV, they didn't find a vaccine, but they did find a cocktail of drugs that would suppress the symptoms. Have you heard of any drugs like that in development or close to being approved?
Jim, I have not. It certainly seems like that would be helpful. What I think the most advantageous thing is the vaccine and vaccination development and accelerating that. Usually it takes many years to develop a vaccine, make sure it's safe, but this is going to be accelerated and may be available as early as next year. The HIV, medications you talked about took many, many years to basically the antiretroviral, right? The virus inserts itself into the DNA and it stopped. It helped to stop that because the virus inserts itself and then replicates itself. As far as the coronavirus and stopping it from hijacking the cell organelles to replicate itself, I haven't heard yet. If you have, let me know. I'd love to
Okay,
look
I
into
will.
it.
I did hear. I was on a investors call yesterday about a company developing one. It would be used in combination with remdesivir.
Remdesivir, yeah.
Yes, it would be used in combination with that.
Yeah, the remdesivir actually treats Ebola, and there have been some data showing that it is improving people that are badly responding to the COVID. One of the most important things we have in the toolbox right now is just steroids. Dexamethasone helps to slow down your body's own response to the virus. Basically, your body is geared up to kill the virus, and then it starts to damage itself. And the steroids actually kind of pull that back.
Yes, this was this drug had already been prescribed and tested through for Hep C, but apparently another drug superior to it came along after that, and it was not so widely prescribed for that. So this has already been through the testing phase and not found to be harmful, you know. So anyway, I think they're looking at before the end of the year, perhaps, to be in the, I guess, third phase of testing. I'll send you the
Yeah,
link,
love to read about
Randy.
it. Love to read
Okay.
about it. Yeah,
Okay.
love to read about it.
Well, I'd like to ask a question. I talked to my boss, Dr. Alpert, the other day. He's a cardiologist down at Banner, and he was saying that they're starting to see people come back who had COVID, and now they're coming back with complications. And I was wondering if you could comment on that.
Right. Some of the complications happen or chronic lung injury. Right. Some people they get a COVID pneumonia, viral pneumonia that's so bad that their lungs can't. The alveolar membrane that lines all our lung spaces is so fragile and thin that if it scars, then you have chronic problems with oxygenation, ventilation, and these people end up with the symptoms like COPD or emphysema, where they need chronic oxygen, chronically short of breath. Sometimes these people are requiring transplants because their lungs function is so bad. And of course, COVID can cause cardiomyopathy, like any virus. After you get a viral infection, you can get a cardiomyopathy, meaning the heart is attacked by your own immune system, and then the heart muscle doesn't pump, and you develop heart failure, and these people sometimes need heart transplants. So there's talk about how the COVID affects the brain, and COVID is causing blood clots and strokes and things like that. It's very, very aggressive virus having lots of effects.
I wanted to say that I accepted an invitation from Tucson Medical Center, and I toured their ICU, their COVID units. They've got several throughout the hospital, and as Randy said, they are expanding their ICU beds. So I learned a lot in that process. One of the things that they said, it's not that we don't have ICU beds. We've got beds. We've got beds with mattresses. We've got the equipment that we can make it into an ICU bed. What we need is the trained staff, the doctors, the nurses, the respiratory therapists, the medical technicians. We need those people, and a lot of our people are sick. A lot of our people are struggling. So Randy, please stay healthy. We need you to stay healthy. But they also said that the governor has worked with the federal government, and they are sending some 75 people to TMC for about 6 weeks to help staff these ICU beds. They also said that and we were going to have Dr. Clifford Martin. He's their chief of staff at TMC. We were going to have him in here to talk, but he couldn't. He had an important meeting that he had to go to, so he let me know today. But he said that there's a disconnect. This is a war. We are at war with an invisible enemy, a deadly invisible enemy. And this invisible enemy could win the war if we don't pay attention and don't take the precautions that we need to take. He said that the disconnect is when you're in the hospital, you see the impact of the war. But when you're out on the streets, you're going to get your groceries, you don't see bombs falling, you don't see people shooting at each other, you don't know you're at a war, you don't know, it doesn't seem real. So there's this clear disconnect. And what I heard from the ICU nurses, from the doctors, from their communications department, over and over and over, is you've got to wear your mask. And please tell the governor to mandate masks. And of course, he didn't do that. What he did today was he put out a nice kind of macho television ad to convince macho men that they're not weak if they wear a mask. And it's like, seriously, just make the mandate. That's all he needs to do. So it's maddening. And I'm not even trying to be polite about it. I'm just saying it. He needs to get his act together because he's failing in leading this state. Failing.
Well, on that happy note.
Nathan asked a quick question, if I could get to it, about high school students. What should teachers know about COVID in regards to effects on students, especially older high school students? I think the most important thing is recognizing students that are at higher risk of having a complicated course with COVID. Young people can very well have a bad infection and have pneumonia, but certainly those that are at higher risk are those with diabetes, those that are immunocompromised. We really need to be paying attention to trying to screen those students and making sure that those students are either getting all distance learning, or if they're coming into a location, they are really protected by being in limited social environments and distancing and masking and things like that. I'm not aware of any particular profound effects on young people that is different than anyone. Most important thing, of course, is the pneumonia. So some people have very mild symptoms, just like flu-like. Other people have no symptoms. That's the danger of this virus. If you look at SARS in 2003, everyone that passed on SARS in 2003 had symptoms. This virus is so contagious, and the fact that people can be asymptomatic and pass it on is amazingly virulent. That's why this virus is so much more dangerous than its predecessor. So I'm not aware, to answer your question, I'm not aware of anything particular about healthy high school students, but the caveat being those students at high risk must be identified and protected.
Okay, one last quick question. I'm sorry, you guys. But so this brings up an issue. What about there's a lot of students at all ages with asthma.
Yeah, asthma is a high risk. Asthma is those students need to be identified and make sure that they are in positions of recognizing they should stay home and do distance learning and when they are brought in, we are highly vigilant about masking and hand washing and distancing.
All right, well, I think we're a little bit after 5 and we had a rousing discussion, and I thank you all for participating, and I want to thank our guests for speaking and filling us in. I think we had, a lot of nice conversation, and everybody, like we all said, wear your mask and stay safe, and if you don't have to go anywhere, don't go anywhere. And if you're an essential worker, I really appreciate what you're doing, and we'll get through this. And as I've said many times on the social media, we should be asking the universe for what we want in the future. We're going to come out of this with a different world. So we want a better world, right, on the other end. So let's think about what we can do different in the future. And I think that there are people out there who are reinventing themselves, and businesses who are reinventing themselves. And so these are all positive things. So anyway, stay safe, everybody. I hope you all voted. Don't forget to vote in the primary, okay? So bye-bye.
Thank you again.